So our first panelist is Andrea Martínez. She is a nonprofit professional who lives in Atlanta, Georgia. She has been actively involved with the ELCA Young Adults and ELCA Youth Gathering, and she will talk to us a little bit now. Thank you.
Like Jen said, my name's Andrea, and we're kind of gonna set the stage for the conversations, and I'm talking about the tale of the two pandemics, systemic racism and COVID-19. I am Venezuelan. I live in Atlanta, Georgia. I have a Bachelor of Arts and a Master's of Public Health, specifically in the prevention science track, which is like the study of effective preventive interventions, emphasizing the development of community and population-based interventions. I'm also a returned Peace Corps volunteer. Like she said, I'm in the nonprofit sector, and then those are kind of my connecting points with the ELCA there on the right. As an individual, I'm particularly passionate about addressing the ways in which social determinants impact health risks and outcomes. And if you don't know what social determinants means, don't worry, we're about to kind of go over that. If I'm being fully transparent, my current state is really tired, really frustrated, really exhausted, fatigued, and not necessarily in the space for teaching, but also understanding that this is important work. And had it not been Jen that had asked me to do this, I probably would have dipped out just for my own personal mental health. So I just want you to know that and understand where I'm coming from. Okay, so we're gonna kind of set the stage to talk about pandemics by talking about social determinants of health. This is kind of the way that I approach and what I focus on. What this means is these are factors that where people live, learn, work, and play affect a wide range of health risks and outcomes. So we're talking about housing, employment, income, education, your neighborhood, not only the characteristics themselves, but also where their location, and then access. And this is a huge body area or sub-area of the public health world. And this is where we start looking at, public health is a soft science, the science being the actual science itself, but the soft part's looking at communities and cultures and leaders, representation, and kind of finding the way those two relate with one another. And so what you'll see when you're considering social determinants of health is, poverty really limits things, limits access to healthy, fresh foods. You have food deserts and all over the US, all over the world, really, and you'll find them and you'll start to see connection that food deserts are in particular neighborhoods, right? You'll see that neighborhoods look differently in certain places, and often they're also married with other characteristics. And I'll get into that a little bit more. And then like with housing, there's a history of redlining in this country and how that impacts. A thing I forgot to mention is that I work at Habitat for Humanity International, the headquarters here in Atlanta, by way of my dining room table for the last 3 months. So housing is something that I'm particularly focused on as a social determinant of health. So then we'll look at like health equity and health disparities. So health equity, as you can guess, is when everyone has the opportunity to be as healthy as possible. And then conversely, health disparities are the differences in health outcomes and their causes among groups of people. And so when we look at life expectancy and infant mortality, and I just use those two because those are really two common indicators of health equity in a particular country or community, we see that the U.S. as a whole has been on an increasing trajectory of life expectancy, and then decreasing trajectory of infant mortality. And so you're like, oh, okay, that's great. Like we're making strides. However, what you really need to do is dig deeper, right? When we break it down further and we start to see certain populations and certain ethnic groups and racial groups and stuff like that, that's when we start to see a disproportionate burden of preventable diseases, death, and disability among particularly minority groups when compared to their non-minority counterparts. And you'll see also disproportionate burdens in other areas, but this is the area that I wanted to focus on for the sake of this conversation. So then we look at COVID-19 and racial and ethnic minorities. I don't necessarily like the term minorities, but it's the term that is most commonly used in like the public arena. And so what the COVID-19 pandemic did is it really just like shone a bright light on what already existed, right? That pandemic of systemic racism was already there. So it really is two pandemics in one, hence the title. And so maybe you didn't realize that it was impacting in other areas, but it really was. Although we're still in the midst of, of all of this and collecting data and adjusting our learnings as we go, the disproportionate effect to racial and ethnic minorities was pretty predictable because of the trends that we've seen with other things, other health inequities. And I just listed a few examples of the fact that like Black women are 2 to 6 times more likely to die from complications of pregnancy by comparison to white women. Native American and Alaska Natives have an infant mortality rate that is 60% higher, again, compared to white. And Black men are twice as likely as whites to die prematurely from stroke. These are just 3 like simple examples of the numerous examples. You'll see that also different rates of cancer rates. You'll see different STI, STD rates. You'll see chronic diseases look differently in ethnic groups. And so these were just a few of the examples. And so just to give you a little bit more more specificity when it comes to COVID-19, we look at the morbidity and mortality weekly report. I know this is like super nerdy, but this is MPH world. This is what I do. I also just recently graduated, so this is probably why this presentation has a little bit of a grad school vibe to it. That's how my brain works right now. So you'll see that what we're seeing right now with these weekly reports is that right now when we're in the studies that there's a disproportionate representation of hospitalized patients who were Black compared to their representation within the larger community. And so then that graph specifically was from New York City from April 16th. And you'll see that the death rate per 100,000 is significantly higher among the Black population than secondary with Latinx compared to the 45.2 of the white population. And then a specific example I also wanted to draw your attention to was the Navajo Nation. We see this example as one of the highest rates of infection. They have a population of around 175,000 that spans over 3 states. And we've already seen 3,100 cases, which is a rate of 18 per 1,000. And we've already seen at least 100 deaths. And so again, kind of unpacking this like systemic nature of this and the disproportionate impact. When we look at this example in particular, I mean, we would be remiss not to mention the fact that the Navajo Nation, along with other indigenous populations, have been historically and systematically disenfranchised by the US government. This area is also densely populated, not just the nation in itself, but also homes in and of itself. There's limited access to medical personnel, to medical supplies, to hospitals, grocery stores. There's a long history of food insecurity that also has a direct connection to loss of lands and territories. And so you'll find that people in the community, are driving hours to the nearest grocery store or hours to the nearest hospital. And so if you kind of take a step back and you think about maybe in these past 2 to 3 months as you've been hopefully quarantining, you know, you might be going to the grocery store on a weekly basis, and I would imagine that for many of us, those commutes are much shorter, and our access is much larger. And then when we look at kind of the way in which public health, again, I mentioned earlier, it's a soft science, and so you really need to contextualize it. You'll look at here, there's an inadequate health and social services. You also see like limited reliable electricity with this particular, the Navajo Nation. And so then when you think about the recommendations that are made of like how to prevent COVID-19, it's really important to adjust your recommendations to the context and to the culture. So when you have a densely populated community, you know, physical distancing may not necessarily be feasible. Or when you have 1/3 of the homes don't have running water and you're talking about washing your hands, you know, all the time and for 30 seconds and stuff like that, you know, that looks different. And not to mention that also the aspect of isolation, the concept of isolation is something that is both physically and culturally challenging. As a generalization in the US, the society is much more individualized, but other cultures don't necessarily have that same approach to things. So what is at the root of all of this? The short answer is that this is exactly how it was built. It looks like this because it was built like this. But what happens is during a pandemic or during a public health emergency, we kind of notice it a little bit more, but it's functioning exactly how it was intended to function and how it was intended by the way it was built. We're just seeing that a little bit more. So the next slide is kind of to unpack a little bit of what I mean by the systemic nature of all of this, right? And these are just a few examples that I thought I would kind of highlight of what I mean by social determinants of health and what I mean by health disparities when we're looking at different populations, particularly in this case, like Black and Brown populations. So when we're looking at, we'll just kind of do like a little span and I'll give you some examples. When we're looking at healthcare and social services, we're talking about limited access, traveling long distance, a distrust of the healthcare system, deeply rooted in a number of things such as common misdiagnoses, a conscious and unconscious bias from medical professionals, and a lack of cultural competence. And then we look at like preventive resources. Again, access is limited. You'll start to see that things start to connect, and that's my intention. Access to preventive materials, masks, cleaning supplies, you know, can everyone really travel to 5 stores to get everything? What about the disposable income to like create your stockpile? Not everyone has that. Then when we look at communication, we look at language barriers, cultural differences in the ways that people communicate. Often certain communities are an afterthought, particularly Black and Brown communities, Indigenous communities. And you'll also see like who delivers the message is really important. Do they have rapport with the community? If they don't, it won't resonate the same way. They have a long history of distrust with a particular official or representative, that'll impact the way the communication is received. When we look at insurance, you know, or no health insurance, compared to whites, just for example, Latinx are 3 times more likely to be uninsured, and Black and African Americans are 2 times more likely to be uninsured. Then we look at housing, you know, we look at the history of redlining, we look at the history of racial residential segregation. People love to pretend like residential segregation isn't a thing right now, when in reality it is. We also live in a world of NIMBY, which stands for not in my backyard. So when your communities are having discussions about who's going to live where, or who gets to acquire what land, a lot of the NIMBY comes out And a lot of times, for example, with Habitat, we might, Habitat organization might acquire land, but then when it comes to having the voting, will often get shut down because they don't want those people in their community, whatever that means. Then you'll look at neighborhood, right? Like the characteristics of the neighborhood. The Black, Indigenous, people of color tend to live in more densely populated areas where it's more difficult to practice prevention measures like physical distancing. And then you have, you're farther from grocery stores and medical facilities. You also, those neighborhoods tend to have less green areas. So talk about like, oh, let's go running in the park and get your, vitamin E kind of situation. That looks different, right? Then we talk about our overrepresentation in jails, prisons, and detention centers. So we look at the mass incarceration, the prison pipeline, which in this country is majority for profit. And so what that means is, your city and your state officials are signing contracts with for-profit companies. And often there's an empty bed clause that is written into that contract. And what that means is that if a bed is empty, then the city officials have to pay the for-profit company, prison company. And so what does that mean? I mean, you could see how an empty bed means money out of the city official's pocket, and then that might impact how policing looks in a particular area. And we start to see that connection with history/current events. Then we look at paid personal and sick leave, and that's tied with employment, and limited or non-existent in many of the sectors where there is higher representation among these community members. And also particularly challenging in during a pandemic when we tell people to stay home if they're feeling ill or if they have a family member that's feeling ill, but also knowing that has a direct impact on their income. Then we look at transportation and how it's tied to employment and income, and more use of public transportation, and how if you change public transportation hours, that impacts if they can get to work or if they can get to the grocery store and stuff like that. We look at employment. These communities are more often unemployed and underemployed. And we look at like the sectors of where they are employed. So nearly a quarter of employed Black and Latinx workers are employed within the service industry jobs, compared to 16%. So 25% to 16% comparison. And Latinx workers account for 17% of total employment, but 53% of agricultural workers. And then Black community account for 12% of total employment, but 30% of licensed practical and vocational nurses. So we start looking at not only this pandemic and the fact that we mentioned service industry, we mentioned agricultural workers, and we mentioned licensed practical and vocational nurses, people that are out there and don't necessarily have the privilege to quarantine are disproportionately representative of Black, Indigenous, and people of color. And then finally, we end with like a legacy of trauma, right? There's numerous other things, but I think it's important to mention the legacy of trauma. And I'm talking intergenerational trauma. I'm not necessarily talking about the trauma of one individual. We're talking about chronic and toxic stress, slavery, lynching, rape, beatings, segregation, state-sanctioned killings, medical experiments, right? We had the Tuskegee experiments. We have birth control that was tested on Puerto Rican women. We have sterilization that was done on many Black, Indigenous women of color, often without their consent or without full information. We have new Jim Crow, we have prison pipeline, we have unemployment, underemployment, right? So this is a lot of factors that influence health disparities, health outcomes. And so pop quiz. No, just kidding. No pop quiz. That was a lot of information. The point was to give you a lot of information, to overwhelm you, right? For you to look at this and understand that when we're talking about systemic racism and then its counterpart, racial justice, we are talking about dismantling not solely the KKK or not solely people who use the N-word. What we're talking about is this is the systemic nature of it. We're talking about the fact that it is built into every aspect of society. And so this is what we're dealing with. And it's a big thing. And so maybe you're overwhelmed, and maybe I talked a lot, and maybe you're like, whoa, that was a lot of information I didn't retain. And that's a little bit of the point, in that there is a lot of information to retain, and it is a lot going on, but also there are a lot of entry points, right? Every one of these are entry points. And I imagine, although many of you, could come at it from an angle of the church, you also have other opportunities to come at it. And so just to end, or maybe you're wondering, okay, that was a lot, where do I begin? I just wanted to mention a few things. These are kind of just some value systems of where to begin, not necessarily specific things. Don't be afraid to be wrong. You might say the wrong thing, you're nervous, you might, offend someone. Yeah, that's probably inevitably gonna happen. So, work through that, make your peace with it. The second point I want to particularly emphasize in this space, Black, Indigenous, people of color do not owe you anything. We are here because of, or I'll speak for myself, I'm here because of Jen, because of Rosella, because of specific relationships with individuals, but they don't owe you to teach you, they don't have to educate you. They don't owe you their stories or their trauma. The reopenings of wounds, like over and over again. So don't ask them to do it. I mean, if they do it, that's on them. But don't strip them of that agency. And so the next point, do the work. Resources are plentiful. It's 2020. You're on a Zoom meeting. You can access a whole bunch of resources, articles, documentaries, books, workshops. And Black, Indigenous, people of color don't need to do your homework for you, right? You can do it. You can start there, and you can Google things, and it's fun and works. And then go ahead and lean into the discomfort, get uncomfortable. It's going to happen. People from these communities, individuals, perpetually live in a state of discomfort. Whereas others have the privilege to walk in and out of it. So go ahead and walk into it. You'll survive, I promise. It'll be good. And also you get to step away. So there's something in that. Think about, like, what is your contribution? What are those entry points for you as an individual, or maybe you as a congregation, or you as a WELCA group, whichever way you're entering this. Align your contributions with your gifts and your skills and your resources. Consider what your privileges are, and then maybe redistribute them. Use that privilege, like, what's your platform? What does your network look like? Is it, addressing things within your family unit? Is it at work? I don't know. Yes, both, maybe, I don't know, but just like consider what those are. Destroy the myth. And by what I mean by this is destroy the myth that whiteness is the central aspect of everything. Destroy the illusion that proximity to whiteness is better, and that whiteness remains central and everything else is on the periphery. I encourage you to also think about how you spend your money. In this country, money matters. Where you spend your money matters. Everything lives and dies by money. So although super awesome for your one-time payment or contribution to a particular nonprofit or movement, also think about, like, where do you go on a regular basis to what businesses, and do they align with the values that you have? How are you supporting Black-owned businesses, for example? And then amplify By that, I mean share stories specifically from the communities, share Black stories, share Black art. I mean, the US already uses it, so you might as well amplify their voices. Use your platform to amplify their voices, not just when it's popular and when there's like a hashtag, but like always. Listen to people who are actively organizing. I don't think that you need to start a different movement. You just join the existing one and think about what they're saying, listen and join what they're saying. Like, what are they saying? What are they sharing? What are the calls to actions? And for example, advocate, call and text and meet your representatives, hold them accountable, use your privilege, sign petitions. And then finally, to vote, you know, look beyond your individual needs, look at who is the disenfranchised within your community, who are the most vulnerable, and think about legislation and how it impacts them versus just your one family unit. And so I'll end with this, which is just like, I have to because it's public health. Also, a way you can do this is by following the direction from your state and local authorities when it comes to COVID-19 specifically. Practice good hygiene, wash your hands, avoid touching your face, you know, wear face covers in public. Yeah, I get it, it's uncomfortable, my glasses fog, totally understand. Also do it, because it's beyond your own individual comfort. It's also the comfort and the health of your siblings. And so that's it.